Dr. Lim is an internal medicine and complex care specialist. Dr. Lim believes in proactively treating his patients so they can attain true health by building solid foundations consisting of a proper diet, nutrients, and exercise. Once they have established a foundation, he moves on to address their more complex health-related issues. Dr. Lim's mission is to explore different approaches to health and to find ways to integrate them all into a comprehensive and cohesive model where patients are seen in their entirety. As part of exploring different approaches to health, Dr. Lim has also become a recent leader in the medical cannabis space, as he believes it has numerous clinical benefits. All of Dr. Lim's training took place at the University of British Columbia, where he earned a Bachelor of Science degree in microbiology and immunology, as well as a Doctor of Medicine degree. He has been in practice as a medical specialist since 2011, and in addition to his work in internal medicine and complex care, he holds training in echocardiography. He is a clinical instructor at UBC and the medical director of Perceive MD, previously Concord Medical Clinic. Perceive MD is a multidisciplinary team-based, patient-focused center providing free, comprehensive assessments for medical cannabis. Dr. Lim, welcome, and I will pass it over to you now. I don't think your video is on now.
Wonderful. I hope everyone can hear me. Thank you for that wonderful introduction, Alana. It's my pleasure to be here. It was very comprehensive, the introduction. I'm not sure how much else I need to say, but just to reiterate, I am an internal medicine specialist, and I am very interested in the medical cannabis space. One of the reasons that I got involved with this area was because I had my patients, or I explored the cannabis with my patients and found that there was some profound benefits, but there was a big lack of data. And so the clinics that I have worked and founded with is a multidisciplinary clinic, and we are data-driven. So our goals are to look at the data, to collect the data, and to better understand what cannabis can be used for. And that's what I'm hoping to share with you today. Because Parkinson's disease is one of those diseases that there isn't just one thing that Parkinson's patients suffer from. There's a host of things. And the current standard of treatment isn't, if I could be honest and frank, isn't great. And so a lot of patients are seeking other alternatives, and that's what I'm hoping to be able to share and shed some light into today, because I think cannabis does have a role. Okay, so as a summary of what we're going to talk about, we'll talk about a general overview of some Parkinson theory. We'll look at the cannabis overview, and then we'll go to some frequently asked questions. Okay, so Parkinson's disease, right? And so when you look at the causes of Parkinson's disease, this is just a summary for what I think many of the attendees here probably already know. There is things like, there's a genetic component to it, like Michael J. Fox. There's environmental causes, listed here, some pesticides and carbon monoxide. There's this very interesting thought that's going out right now about this gut-brain connection, whereby a lot of the gut microbiome actually causes influence to our mind and how we think, and it can lead to some changes that cause Parkinsonian-like symptoms. Then there are, risk factors like age and a family history. Males are more likely to get Parkinson's than females. Environmental exposures. And then essentially what happens in Parkinson's is that you get this breakdown of the nerve cells. And it's mostly the dopamine releasing nerve cells, which is why things like the standard of treatment is like Sinemet or carbidopa, which tries to replace the dopamine. And the idea is that some of the symptoms of Parkinson's, and you'll see as we go through the theory that not all of them can be explained with just dopamine releasing cells, which is why that Sinemet only addresses some of the symptoms of Parkinson's. So this was a theory that was proposed that I really, really liked. And it talks about Parkinson in stages. And so most people don't read, or most people, when they think about Parkinson's disease, they think of, things like the cardinal symptoms, which is the bradykinesia, which is a slowing of the movement, or the pill rolling tremor, or they look a bit flat in terms of how they look, right? Or they start tripping. But that you'll see here actually is kind of a later stage, usually in the stage 3, right? So, but Parkinson's disease may start as early as stage 1. And this is why I like this, because there are subtle features of Parkinson's that may be present before what people think, like, oh, you must have Parkinson's, or they start noticing the pill rolling tremor, and that's when people start screening for it. So when you look at it, in the first steps of Parkinson's, or the first stage, you lose things that are more non-specific. So you get less smell, you get things like you get constipated, and that's as you go up from the brainstem up to the higher levels of the brain. Okay, so just to give everyone here an idea, or a review, this is our brain here, and you'll see that the lower parts of the brain are what's called the more rudimentary parts. This is like for your breathing center, and what differentiates us as humans is more the upper brain, which is our complex thinking and our critical thinking. So this stuff down here in the brain stem, the green and the whatever stage 1 is sort of a yellow green, that's sort of the primitive centers in our brain. Okay, and so that's where you get things like constipation and smell. And then as you move up, you start to affect some of the substantia nigra, which is where you usually cause problems. And that's when you start getting symptoms like, okay, you get these odd pains that really, you really can't necessarily pinpoint. You get some mood issues, fluctuating mood. This is where people start noticing sleep, right? And so sleep is one of the things that's really affected in patients with Parkinson's, right? And you'll see here that you could imagine that when patients present in stage 1 or stage 2, it's rather difficult to say that, yeah, this person has Parkinson's, because these could be from lots of different things, right? Sinus issues, poor sleep could be from stress, mood can also be from stress. So it's not until you get to stage 3 that people start noticing things like, okay, you're moving slowly, you're getting more rigid, you're getting some freezing, and then that's when you get the pill rolling tremor. And then when you look back, you'll start seeing that, oh yeah, I had all these other symptoms too. But what's interesting also is that Parkinson's doesn't stop at stage 3, right? And so as you move up into stage 4, stage 5, stage 6, you start affecting other things that actually become more significant, right? So as you move up, you get more emotional problems. That's when you start getting more long-term problems. And as you can follow this arrow up the brain, as it goes up higher and higher, you start getting more and more of the areas in the brain that makes us unique as humans. Okay, so the critical thinking, the memory, the planning, the executive planning. And so this is Parkinson's, and I think it's really nice overview. So just as a very general review, all that I really wanted to show here was these are the cardinal symptoms of Parkinson's. These are like what people think of as classic, but this is not all that Parkinson patients deal with, right? Because there's a lot of mood issues in Parkinson's patients that may go underappreciated. There's psychotic things like people can start to hallucinate, and then there's cognitive, like the dysfunction of thinking. Fatigue is a big thing, we don't treat very well. Sleep disturbance is also probably related to fatigue. And all of this is just trying to say that if we look at Parkinson's, we have to look beyond the pill rolling tremor or just the tremor. We have to look beyond that. We have to look beyond just the rigidity, because there's so much more in terms of what affects a patient who deals with Parkinson's, their quality of life, what affects their quality of life. Pain is also a big one. And so here, more features, you can look at them. I'm sure that for the guests here or the attendees here who suffer from Parkinson's, they don't necessarily need to read this list because it's something that they already experience in their lives or in the lives of their loved ones. So now let's go to cannabis. So very briefly, let's just talk about like cannabis overview. Okay, so cannabis is a plant. This is a plant. There's two different types. There's actually three different types of cannabis. There's sativa, indica, and ruderalis. Ruderalis doesn't really have any medicinal properties, so I've left it out. For the most part, indica and sativa are more historical, the way that Canada has been growing, because most of our products are hybrids. And it just, for the most part, the only thing I want to tell you about sativa and indica, because you will experience this or you will come across this if you are looking at cannabis treatment, is that the CBD or the THC, okay, which are your cannabinoids, that you find in sativa and indica are exactly the same. So that was one thing that I never quite realized when I first got into this field, which is, CBD, if you get it from sativa, or CBD if you get it from indica, is exactly the same. Same with the THC, they're chemically the same. What differs in the sativa and in the indica plants are mostly the terpenes, okay, which I'll talk about, and the minor cannabinoids, okay. So cannabinoids are these unique molecules. They're actually not necessarily only found in cannabis. They can be found in other plants, but for the most part, they're found in cannabis, that affect the host, usually through the endocannabinoid system. CBD, THC are the most predominant of the cannabinoids, okay? Terpenes are these other molecules that are found within the cannabis plant that essentially gives it the fragrance. So, when you smell the cannabis, you can smell, that's the terpenes, but they also have medicinal properties. And in actual fact, terpenes are usually from other plants. Okay, so like spices have terpenes, like parsley has terpene, and then they've just bred into the cannabis out in the wild. Okay, but again, the only thing I want to mention here is terpenes by themselves have medicinal properties, and when you combine terpenes with the cannabinoids, there's some thought that they may act more synergistically together. All right, so how can you? These are the ways that you can take cannabis. I'm going to talk about how cannabis can be used in Parkinson's, but just generally, how can you take? What are the methods of consumption or modes of consumption? So, the most common that most people think of is smoking. Okay, this in our clinic is the least favored. Why is it the least favored? It's hard to control what you actually get because you're smoking the entire joint, for instance, and you may be trading a benefit for a long-term side effect, or not a long-term side effect, but a long-term problem. Okay, so like, why would you get pain control and then get lung problems? Like, why do that when there's another way to take it? If you are, there's some good things about it, because if you do smoke or vaporize, it has a faster onset, but it also comes off less. It also wears off quicker. If you're going to smoke, though, try to use a bong, because it has a water filter on it. Vaporize is the other way that I think most people may see out in the public. And this one you can use usually is you have a dried flower and you put it into a vaporizer, it heats it up, and under different temperatures or boiling points, you can vaporize the cannabinoids and you inhale it. This one, there's probably some benefit to it because it's, again, very fast onset. So if you're in pain, you can take a puff of the vaporized product and you can get effect within usually about 5 or 10 minutes, but it also doesn't last that long. It usually lasts for about an hour or two. The most common in our clinic is usually in the oral route, so either a sublingual buccal or a capsule. Okay. And so usually you can use, you hold it for 45 to 60 seconds underneath your tongue. The big things to note here is that when you're taking an oral route, whether it's underneath the tongue or an edible like a capsule, it can take up to 2 hours to onset. Okay, edibles include capsules and with fixed doses, and also edibles can include baked foods or like cookies. We usually, for medical, don't use edibles like gummies, because again, you oftentimes trade one problem for another, like these high sugary cookies or high sugary gummy bears, and so it has only a little bit of CBD or THC in it, mostly CBD, and then you take all that sugar in. And then there's topical that's coming out on the market soon, or there's some products already out on the market. I think this has a lot of potential for localized pain. So how can cannabis help in Parkinson's? So this is not just how can cannabis help in general, but this is, remember, my talk is specific for Parkinson's patients. How can it help? So there are really four main areas that we in our clinic have seen it having benefits. Okay, so in sleep, in pain, in the tremor, and in anxiety or mood disorders. So what does the data show? This is the truth about cannabis. So is cannabis a miracle drug that cures everything? Okay, so obviously the answer is no, right? Is cannabis a real medication? Now, normally in my PowerPoint slide, these would come up one at a time, but in this way, it just all pops up at the same time. So I sort of give away my answers right away. But yes, it's a real drug, and here's what it can help for. And we have really good emerging evidence that it's useful in things like pain, in poor sleep, in tremors, anxiety and PTSD, seizures, and inflammation. Okay, so here's the stats. Here's what it looks like. This is real life data from my clinic. Okay, so this is for pain, specifically for pain. You can see here, okay, that of these people, the predominant people had some improvement, right, in pain. And this is all comers of pain, right? Most of them, can you imagine, maybe a third of the patients had a significant improvement in their pain. So you're talking like at least a 75% reduction. And when you look at the dose, it's an average of 25 to 50 milligrams per day. 76% of our patients had an improvement within the first month. This is actually improving as we get more data and we can be a bit more aggressive in our dosing. 82%, right? 82% had some improvement at the 3-month mark, right? And the reason for this is because we can titrate or help the patients adjust their medications or their medication as we see them in follow-up. And you look at this, the average pain, and this is pain again, all comers, not just Parkinson patients. So all comer pain, their average pain that they said that they quantified was 7.4 out of 10. So it's pretty significant pain. 7.4 out of 10 is pretty significant. And the pain reduced by almost 48%, by almost half. Okay, so this goes down to about 3.8. Okay, and again, 14% of patients improved by more than 80%. When you look at these numbers, this is comparable to the opiates. Okay, except that we know that opiates have other issues like addiction.
Dr. Lim, we have a question if you are up for answering something. There's a question here. Are there any issues with interactions with other Parkinson's disease medications?
Great question. So, and I'm going to touch on that a little later, but I will answer it as well now. The answer is that cannabis does, or CBD and THC, they do interact, or they can interact with medications. Now, specifically to Parkinson medications, the answer is it depends, because Parkinson medications, like I had mentioned earlier, isn't just one thing. Will it interfere with Sinemet? The answer, or carbidopa? The answer is no. But will it interfere with some of the other antipsychotics or antidepressants that you may be on as well? The answer is yes. Will it interfere with or interact with benzodiazepines, which some Parkinson patients are on, for instance, for sleep? The answer is yes. And so it's important, and we've realized this, to have a team manage your care. Okay, so, I'll be the first to admit, even with all my training, I am not a drug expert. Okay, there's just too much to know. But pharmacists, that's their job. They are drug experts. So that's why we have clinical pharmacists on our team to review all of our patients to make sure that there are no drug interactions. So kind of a long-winded way to answer it, but yes, the short answer is yes, it can interfere with Parkinson drugs or interact.
We do have another one here.
Yes.
Does the dose include THC?
So yes, so these doses are 25 to 50 milligrams of CBD. Okay, I should have been more clear here, sorry. 25 to 50 milligrams of CBD. And there is a little bit of THC, and usually the doses of our THC are in the 1 to 2 milligrams. And the reason for the THC is mostly because none of the CBD that we get in Canada is hemp derived, which means that there is always some amount of THC in our CBD. Now, I will say that actually this may be a good thing, because THC is really, it's often needed for CBD to act better or to be more effective. So a little bit of THC with more CBD actually is better. But this is a CBD only dose. This is just for CBD. Okay, so let's look at the tremor. So this one we don't have as much data, and you can see that the numbers aren't very much, but there is some improvement. Okay, and so some improvement in our tremor patients, just because the reason that our numbers aren't very high is most of the patients who are being referred to our clinic is for pain and anxiety. And so again, most people experience some improvement, and again, a significant improvement in tremors, right? And the dose, again, about 25 milligrams per day is on average what these patients had effect on. So what about insomnia? More data, right? So this is for people who have trouble sleeping. Average dose, 26 milligrams per day, again, of CBD. THC also has a huge benefit, but we use it more cautiously, especially in our Parkinson patients, because there is a risk of hallucinations hallucinations or cognitive issues with THC, and so we tend to use it cautiously. I will tell the attendees here that CBD actually counters the effects of THC. So if you have a predominant CBD, like let's say you're on 50 milligrams a day of CBD, adding say 5 or 10 milligrams of THC is not the same effect as going on no CBD and just taking 5 or 10 milligrams of THC. Okay, so CBD actually directly counteracts the effects of THC. And so you can see here that cannabis in both CBD and THC together can be hugely effective at treating insomnia, right? So again, you look, I mean, you know, yes, a significant number of people didn't find any benefit. That's okay, right? But a great majority of people had significant improvement. Okay? 83% at 3 months. And then anxiety, right? So when you look at anxiety, also a lot of people improve. Okay, so 87% over 3 months, average dose about 27 milligrams. This is again predominantly CBD, not very much THC at all, because we know that long-term consequences of THC actually may worsen depression and anxiety. So this is, you know, the point that I'm showing this is really just to show everyone that, you know, the clinic is A, data-driven, and B, we are having data, right? You can see here that not very many people get worse, right? All of these things, very little people get worse. And so it's safe and it's potentially very effective. Okay, so are there risks to taking cannabis? And the answer is yes, right? So there are side effects to cannabis. THC, I usually break them down into two. THC is what we're mostly, you know, what we hear in the public. That's the stuff that makes people high. So obviously it's side effect, or not necessarily a side effect to some people who want it, right? It makes them high. It makes them drowsy. This is why it can be helpful in people who with insomnia. It can make people have balance issues, so they feel a little bit unsteady on their feet, which can, again, we use this cautiously in Parkinson patients because Parkinson patients tend to have stability and mobility issues already, so we use this cautiously. It can lead to dizziness, again, the same reason that we use it cautiously, because we don't want to make any of the mobility issue in Parkinson's patients even worse. Palpitations, dry mouth, and so and these things, right? Hallucinations and worsening of anxiety. And so we use THC very strategically and very cautiously in our Parkinson patients, and usually only when they are on much larger doses of CBD. So what's the side effects of CBD? You know, quite literally not very much. There are some patients of ours who report some loose stools or diarrhea. I'm actually more convinced from a clinical standpoint that the loose stool and diarrhea is not so much from the CBD itself, but rather the oil. So the oil that we're using is an MCT oil, so a medium chain triglyceride. And some people, you know, if you take oil, it gives people kind of makes people a little bit gassy and gives people loose stools. And I think that's probably more of what the issues are from, rather than from the CBD. But it is something that we notice. Some people, if they take it for insomnia, some people get the reverse. They feel like they're totally energized. That's rare, but we've seen it. And there are some people who develop some lightheadedness or dizziness, but we think in our clinic it's probably more to do with the fact that our CBD here in Canada always contains some THC. And there are some people who are just very sensitive to THC. Addictions. Is there an addictions risk? So THC, there is an addictions risk, but you can see it is extremely small. So just to show you on the line, so this line up here is nicotine. We know that nicotine is one of the most addictive drugs out there. So this is smoking. This is why smokers have a really hard time stopping. And then you look here, this black is alcohol. Okay, we know that our societies have problems with alcohol consumption, but for the most part, most people don't get addicted to alcohol, but you can see that it's got a significant. Cocaine is actually right up there, not that addictive cocaine, just as much as alcohol. But you look at THC and look at it. And this is a logarithmic scale. So this is orders of magnitude smaller. And so you see that it's not a zero, right? But it's really small. Okay. Is there any addictions risk to CBD? The answer is long-term, we don't know, but it doesn't look like it from a clinical standpoint. There's no documented withdrawal symptoms. So if you stop, people are always worried, okay, if I stop my medication, do I get worse? In actual fact, we've found some really remarkable things with CBD, whereby as we escalate the doses of CBD and our patients respond, what actually they can do is once they reach a clinical response, they stay there for like 3 months. And then some of them, for financial reasons, usually they stop or they don't take it as often, and they realize actually that the benefits are still there. And so it's not something that I can necessarily explain, except for maybe physiologically your body upregulates the receptors and it gets more efficient at this. But I have patients who, for instance, take CBD for pain, and after 3 months, you know, they would take it every day or twice a day. And then after 3 months, they would take it once every third day, or, you know, once a week or twice a week. So it's really very surprising with good control. And then there are some studies out there that suggest, okay, maybe CBD actually can help with other addictions, like, you know, cocaine addiction or opiate addiction.
I have a couple questions here, Dr.
Yes, of course.
Sorry to interject again. Is CBD obtained by prescription only?
Yes, so
I think CBD
right here.
They meant.
Yeah, so it's going to be right here. So the answer is no. You don't have to get CBD through a prescription. Now, I will say this though. I'd like to think, you know, we're 2 years from the legalization of cannabis in Canada. And yet, despite that, believe it or not, there is still a lot of gray market stores out there. They're decreasing, but they're still there. And a lot of them have fled to online. So I have still, believe it or not, there are patients of mine who order CBD because a friend told them to order from this site, and the site is an unregulated site. Sorry, an unregulated product site. They're not Health Canada approved. And so they're selling gray market products. And the fact of the matter is, when I ask my patients, it's the same price as the regulated product. So I'm not really sure why one would go, besides the fact that one may not realize that that's a gray market site. And so the best thing to do is, if you're looking for it, go to a government regulated retail store. You can go on the BC website and find out which stores have a license. And you can also find out which companies are licensed through the BC government website. So hopefully that answers that question. Do you want to ask the next question, Alana, first before I go into this?
Sure, some really good questions here, a couple more. Can you recommend some strains, brands, where to buy, doctors who we can talk to? Do you see patients yourself and prescribe cannabis?
It's a great question, and I'm going to answer all of those as we go through. I promise.
Okay, the next one is actually about CBD, so maybe you want to answer that one.
Sure.
CBD isolate versus full spectrum CBD. What's
great
better?
question. Great question. So CBD isolates, there are some companies out there that will sell you a CBD isolate, and so the evidence for the difference between the two isn't great. But I can tell you that clinically and from a theoretical and physiologic standpoint, full spectrum is probably better. And the reason is that full spectrum allows more synergy. So there's this phenomenon called the entourage effect that suggests that in combination, the minor cannabinoids or all the cannabinoids act together and the terpenes to provide a more complete response rather than a single pointed response. Also, there is some ancillary evidence to suggest that CBD isolates may not act as well because you'll need higher doses. So, for instance, there's a product on the market for seizures called Epidiolex. Epidiolex is used in the treatment of childhood seizures. That's all that it's really approved for, certain childhood seizures, and it's 99% CBD. Now, you talk to the company and they'll say that it's a full spectrum, but the fact is that it's 99% CBD, so it's actually really close to an isolate, even though it has the other things. Now, if you look at the doses of Epidiolex for treatment of seizures, you're looking at between 800 to 1,500 milligrams. That's a lot. So if anybody has ever purchased CBD, you'll know that a usual standard 40 ml bottle of 25 milligrams, that's usually a standard, is 1,000 milligrams. And so when you look at the Epidiolex to treat childhood seizures, you're looking at consuming one entire bottle twice a day, right? So it's a lot. And so it's a bit anecdotal, so don't quote me saying that isolates are not as effective, because we don't know. But based on all the information out there and trying to gather everything and putting it all together, my opinion, my medical opinion only, is that the full spectrum is more efficacious or acts better or more effectively than the isolates.
And one more question.
Yes.
Perhaps you can comment on this. My doctor and neurologist told me there is no real proof that CBD works.
Well, so I can say that unfortunately, a lot of my colleagues continue to say things like this when it's not true. And I've been trying to single-handedly speak to all of my colleagues across BC and across Canada about this. First of all, if they ever say things like that, you can tell them about the phase 3 trial for the Epidiolex that I just mentioned. So that's medical cannabis. Epidiolex is the CBD for childhood seizures that has phase 3 trials. So to not get too technical, phase 3 trials where you get this randomized double-blind control trials is the gold standard for evidence. And there is phase 3 trials for Epidiolex in childhood seizures. And so there is lots of emerging evidence to say that CBD is useful. A lot of the neurologists and a lot of the GPs, they say that because they don't know. And so what I've been trying to say is that instead of saying no, why don't we co-manage the patient through, for instance, through Perceive MD, and then we can all learn together. right? And so that's what we've been doing. So for instance, a lot of the physicians, the neurologists who did epilepsy at Vancouver General Hospital, they didn't know anything about medical cannabis, but their patients were all on it. So what did they do is that we work now directly with them. So we see all of their patients who are on medical cannabis, who are on cannabis and also happen to have epilepsy. So now we share their patients, and we manage the cannabis side and they manage the epilepsy side, the pharmaceutical epilepsy side. And we work together as a team. So I think that that's a much better approach than saying, nope, there's no evidence, don't go and try it. Okay, so if that's all for now, I'm going to answer some of those other questions that were asked. But here, so I think this is one of the questions that was asked. Should I just go get my cannabis from a store and just try it out myself, right? Because everything's legal, I can just go to the store. Now, I will tell you this. Going to the store and getting it from a medical prescription, exactly the same product, okay? I don't want you to think that the store has products that are inferior to the medical realm. It's not. It's exactly the same. So you say, okay, well, why don't I just go to the store to buy it? Well, there's a few reasons. One is that it's always better to get a medical practitioner involved if you're really trying to treat a medical problem, right? That's my stance on everything. I mean, if you have diabetes and you're trying to treat diabetes with your diet, you should really try to employ the help of a dietitian so that you can do it properly. And so that's one thing. The second is that in the medical route, you can get compassion pricing. So if your income is below a certain level, a lot of like Perceive MD, for instance, can help you register with the producer that can get you a discount. Whereas if you go to a retail shop, they're not going to give you any discount. You just pay retail price. The third is in regards to pricing as well. When you get a medical document for your cannabis, you can write it off on your taxes, because now you get a medical prescription. It becomes a medical. It's prescribed by a physician, so it becomes a medical expense. So you can write it off on your taxes, and some of the third-party plans are covering it. Okay, so those are the reasons. And you know, it's here as well. So the no medical supervision. Do you really want to just go and buy from a retail store and then try to dose it yourself? You know, if you're getting side effects, who do you ask? If there's drug interactions, which we already know there are, who do you go to, right? So those are the reasons that I usually give patients to say, hey, like, why would you go try to do this on your own when you clearly have, you know, a medical condition for it? Why don't you employ the services of a practitioner? Now, I will also say right now that all of our services are free. Okay, so I don't want people to go out there and say, well, I would employ a medical service, but if I could afford it, but I don't have any money. All of our services are covered under MSP. So as long as you are, you know, you have provincial coverage, you will not pay anything to get our services. I mean, obviously you'll have to pay for the product because we don't control that, but our services, you know, you see a pharmacist, you see a nurse, you see a doctor, all free. How much does it cost? This is another one of those questions that I always get. Okay, so in general, it's about, I would say on average, about 9 or 10 cents per milligram. So if you're on 50 milligrams a day, you're about $5. Okay, and a capsule, they've come down in price about the same. So, you know, if you're on 20 milligrams a day, for instance, you're spending $2 a day. Okay, so in a month, that's about $60. 1,000 milligram bottle is about $90. And depending on how much your dosing is, right? Some people can get away. We have some patients who use $90 every 2 months, and some patients who use $90 every 20 days. Okay, and so you can see that again, there are benefits, right? If you're spending, you know, $145 or $135 a month, it's, you know, and you be eligible for instance, compassion pricing, and you get 20% off or 15% off, and you get a tax deductible. I mean, it adds up. Right? this is the question that was asked. Okay, so how do you get to be seen? So you can just have your GP refer to us. Okay, and I can give Alana all of the referral information. We even have a referral sheet that the physician just fills out and signs and then sends to us. So we are a referral only clinic, but again, we are 100% covered by MSP. We require referral either from a GP or your neurologist or any other doctor. And what's the benefits of seeing us? Well, you see a pharmacist to make sure that there are no drug interactions that we need to be careful about. You see a nurse that can help with your intake and answer any questions. You see a doctor who can also help. And then you see an educator or a coach that can help you register with the licensed producer, help you register for compassion pricing, help you place your first order. And then, once you get your product and it comes, for instance, in a bottle and you look at it and you're like, I have no idea how to take this, the educator can walk you through like, okay, this is how you take it. And now we're doing everything virtually, so you could just do it from the comfort of your home. We use a virtual care platform called Olo Health that we can, connect with you on by video or by phone, and then we can help you through. And this is what we help you with, right? Okay, so dosing, side effects, drug interactions, education. So that's it. So this is the website for Perceive MD. This is our phone number in case you want to call us. Yeah, or you could just email us. Okay. And again, Alana, I'll give Alana the whole package of what we need, of what you need to get a hold of us.
Some more questions here. Can I ask for a prescription from my family doctor?
Absolutely. So yes, any doctor can fill out a prescription. If your family physician or your physician has never prescribed cannabis before, I can tell you that they're probably going to say no. And the reason they're going to say no is because to prescribe cannabis is not the same as prescribing any other drug. It's really, Health Canada has really bungled it up, and it's not necessarily complicated, but it's very different than their usual practice. And so, yeah, but if they prescribed it, by all means, yes, they can prescribe it. And if you want, they can send it over to us, and then we can take that medical document and submit it on your behalf and help you. And so you can use any part of our service, right? So if you say, okay, I only want to use your educator service, you can have your family doctor send us the medical document, and we can send it to one of the licensed producers on your behalf, and we can help you educate, and we can help you apply for compassion pricing, all that stuff that I suspect their office wouldn't want or wouldn't necessarily offer you.
And I'm not sure about this question if I'm reading it properly. Do you take PT from USA and cost? I'm not sure what the PT means.
Do we take products, maybe? Do we take products from the USA?
Maybe guest 879, can you elaborate? Patient maybe?
Oh, do we take patients from the US? Maybe that's what it's saying.
I think so.
We can take private patients. Yes. And we can, but it would have to be private pay because they would no longer fall under the BC provincial coverage. If you're from out of province, it would have to be private pay again, mostly because the provinces don't have an agreement with each other for medical cannabis and for virtual. If you're from the US, it becomes a challenge because then we have to recommend the product that you have to go look for in the US, which doesn't sound hard, but the difference between Canada and the US is in terms of regulations. So in Canada, the federal government and Health Canada has mandated that all the licensed producers be regulated, which means that they control, things like dosing. There has to be certain criteria for quality and for consistency of the label. So if it says like 25 milligrams per mil, that there is about 25 milligrams per mil in there. So it's like accurate packaging. In the US, those regulations don't exist, which means that the package can be anything and it could be completely different what's inside the package. And so it's unfortunate, which means that in the US, you could have a much more variable response.
All right, thank you. Another question, does cannabis help with dopamine levels?
The answer is no. So CBD can affect things like your serotonin and your dopamine and your norepinephrine receptors, but cannabis in and of itself does not increase your dopamine. Okay, so now that's not to say that it doesn't help with the Parkinson tremor. Okay, so you just remember that the Parkinson tremor is there because of dopamine nerve cells have died or have been injured, and they therefore can't act on subsequent nerves. So it's like one nerve here that's dopamine releasing that acts on this nerve, and this stops working, so this nerve doesn't work normally. Okay, but this nerve can be regulated directly by CBD. Okay, so for instance, if it's a hyperactive nerve, it can be attenuated so it's less active, just like dopamine would, but it's not dopamine. Whereas Cinemet and the other dopamine agonists actually go in and give the body more dopamine, which does the same thing to this nerve. Okay, so it's called an efferent nerve.
Okay, and can we get a free consultation, initial consultation?
Yes, like I mentioned, everything is free, except for the products. Again, I don't control that, but the whole assessment, this whole thing about Perceive MD is free.
If we get referred to Perceive, is the consultation virtual?
Yes, yes, we have moved to virtual for COVID and also to better serve our patients. And also we realize that a lot of our patients, they have mobility issues, so being seen at home is better. Yeah, so for those reasons, we've decided to go completely virtual.
I don't see any more questions in the chat box, but I have a question.
Of course.
So, I think many neurologists might be cautious in recommending cannabis use. And do you think this has something to do with the concern about the hallucinogenic effects? Or do you attribute it to something else? And is there a high risk for hallucinogenic effects for people with PD, or does it just vary from person to person?
It's a good question. So off the bat, it definitely varies from person to person. But the issue really with neurologists, or actually any physician who doesn't consider or won't consider recommending or trying cannabis, is really their own biases. And no matter what, I think sometimes people may forget that physicians are human. So they're just as human as anybody else. We're not superheroes, which is to say that there is inherent, like, we live our lives and we still get biased by things around us. So, if people or physicians have a son or a daughter who got addicted to cannabis, or a friend's friend who got addicted to cannabis, or they deal with addictions medicine themselves and they see people addicted to cannabis, that they would say, no, this is not a drug. But my argument for to that would be the opiates. Look at the opiate crisis that we're in right now. Okay, it's a terrible crisis. More people die from opiate overdose than from COVID. But I would challenge any person to undergo major surgery without opiates. No one would do it. It's inhumane. Okay, so the point being that cannabis, just because cannabis has been abused, it doesn't mean that it has no medicinal benefits, because it does. And so the problem is that people tend to bring their own biases into their practice because we're just human. And there isn't great evidence yet, but I can tell you that lots of things that we do in medicine don't have great evidence. Okay, I'm sure that some people here, I'm certain of it, must have been given gabapentin as a prescription drug in the past. Now, I would challenge any of you to ask your physicians to show you what the evidence for gabapentin is, and I can tell you that it's quite bad. Same with the opiates. Not great evidence for chronic pain use, but we do it. Same with surgeries. Most surgeries have no good evidence that they work, but we do it. What I'm trying to say is, I'm not saying that surgery is bad or that gabapentin is bad or that opiates are bad. I'm just trying to say that there are lots of things in medicine that we do that doesn't have great evidence because we learned over time that it works. Okay, when your appendix bursts and we have to go remove it, there's no evidence for that, right? No one did a trial to say, okay, if we didn't remove it versus if we did remove it, do you die? Because you wouldn't be able to do that study. But surgeons will remove that appendix. That's all I really have to say about that.
Sure, that's understandable. I think that.
Oh, sorry, Alana. Just one other thing. I just wanted to say, because there was another point that you made there that I didn't answer, which is the other thing is that most physicians think of cannabis as THC. And so, yes, and I already mentioned it, I am very cautious about giving my cannabis patients THC. Sorry, about giving my PD patients THC, because if they already have imbalance issue or dizziness at baseline, and I gave them a whole bunch of THC and it just made it worse, they're going to fall and they're going to break a hip and I'm going to make them worse. So for sure, do I want my Parkinson patients high? No, usually not, right? But there are some instances actually when the disease is so debilitating that maybe getting a little escape from the reality of the terminal illness is actually a benefit. But CBD, on the other hand, doesn't have these issues, right? And so that's the problem is that a lot of the people, when you ask them about medical cannabis, they think, oh, you're going to smoke it and you're going to be THC. It's really very far from what we do at the clinic.
Yeah, I was just going to say, yeah, that's understandable on the one hand. Despite its legalization, for sure, there is some stigma that is still attached to it, and perhaps a misunderstanding between CBD and THC. So I think when people think of marijuana, they think of being high, which is really attributed to THC.
Totally.
And a couple more questions here as well. Does cannabis help with stiffness?
So the rigidity, I think that question is probably referring to the rigidity that Parkinson patients feel, where it's almost like things get stuck. And the answer is maybe. And I don't know the answer necessarily because we don't have good evidence for it. And the reason that I say is maybe is because when you physiologically, what causes the stiffness or the rigidity in Parkinson patients? It's actually not to do with their muscles. It's to do with their nerves. Okay, it's the damage in their nerves that cause the sort of cogwheeling. Okay, and that cogwheeling is, if you can fix the nerves, with CBD, you can, I guess, theoretically or physiologically improve that rigidity. Now, if it's strictly a muscle rigidity, because there are some rigidity or stiffness from the muscles itself, I don't know. Right? There is some suggestion, though, that CBD is anti-inflammatory. So if it was from inflammation, then the answer is maybe it does help. But yeah, I don't know the answer for sure.
Okay, great. Another question. If my doctor or neurologist refuses to refer, what do we do?
So, if you try and you really can't get referred, we can, we recommend usually like a walk-in clinic. Okay. to get a referral. And if you really can't, we have a no refusal policy.
All right. And perhaps you can comment on this comment. My mom was on gabapentin for years and it didn't do anything.
Yes, I saw that comment actually. It's like what I said, right? The evidence for gabapentin. It just sort of made me laugh when I saw it, because I know lots of people like this, and this is exactly one of those things. We give things in medicine all the time based on what someone else may have told us, and we've never really looked up the evidence, and there's no evidence for it. That's why gabapentin doesn't do anything.
Does CBD help with pain?
Yes, and so that's why I put the slide up again to show you that it does help with pain. You're looking at almost a 50% reduction.
And this is a really good question here. How about patients already having hallucinations?
Yes, great question. So in patients already having hallucinations, I would certainly opt for minimal THC, which means that, again, another reason not to just go to the retail store to get this. Different companies have varying amounts of THC in them. So even though the bottle may say, let's say 25 milligrams per mil of CBD, the amount of THC in there varies from company to company. Some people have like 0.8 or 0.4 milligrams per mil, and some people go all the way up to 1 or 2 milligrams per mil of THC. And so if someone already has hallucinations, our team would be very certain to make sure we choose a product for the patient that has the lowest amount of THC in it, and just mostly CBD. And the CBD can actually potentially help with some of the hallucinations.
We have time for a couple more questions. Do you have patients who take quetiapine? Is that
Quetiapine.
quetiapine?
Yes. So there are, yes. So, I mean, we've seen, I want to say probably like 2,700 patients now. So you can imagine that we've seen just about every drug out there in terms of combination. And so, yes, we have many patients on quetiapine because it's a pretty common drug. And that's why our pharmacists work directly with the patient and the physician to make sure that, okay, if we're going to start and there's a potential interaction, these are what to look out for. And that's why we see our patients regularly in follow-up. So unlike, some other clinics, that may say, okay, here's your prescription for 6 months, go away. We make sure that we see our patients regularly because, I mean, it's a journey. It's a journey that we go along with the patient.
Okay, and one more question here. Or two more questions. What would be the best time of the day to take CBD?
So there's no real best time to take CBD. It really depends. So there are some patients that we have, for instance, that have predominantly insomnia issues. And so we tell them to take it at night, a few hours before they sleep. But sometimes, and it lasts the whole day the next day. So it really depends on the person. And that's something that we usually try to help the patients figure out. Usually the oral oil or capsule lasts for about 8 to 12 hours. Okay, and so it depends. If you're trying to help with the tremors in the daytime, you may take twice a day in the daytime and at night. Or if you're mostly for tremors and it only bothers you in the daytime, maybe you just take it at the daytime and not at night.
All right, and does THC build up or accumulate in your body?
So the answer is yes. THC and CBD probably do accumulate. They're very lipophilic, so they do probably stay in fat. But does that mean that you get addicted, or does that mean that you actually get tolerant? And the answer is we don't know. There's some suggestion in the literature when you look at the addiction studies that that people who use like a lot, and I'm talking like a lot, like 5 to 10 grams a day, that they do get withdrawal symptoms. But 5 to 10 grams a day I mean, for a lot of people, they may not realize how much that is, but that's an astronomical amount.
Okay, I think we have time for one last question here. 2 more questions, and I think then we can wrap it up here. I love that you guys have these really great questions. Thank you. makes for a better presentation
I agree.
when we have that dialogue. How do we decrease drowsiness in the morning when taken at night for insomnia?
Good question. So you can either try to take it earlier in the evening so that its effects are not lasting as long. So for instance, if you're taking it 2 hours before bedtime, and then you're finding it that it does help you sleep, but in the morning when you get up, you still feel drowsy or a bit groggy for a remaining 2 hours, then you may push the dose back to take it 2 hours earlier at night, or you can reduce the dose.
And the last question, if using CBD, should I stay away from alcohol?
I mean, in general, unless one is consuming a copious amount of alcohol, probably not. I mean, if you're drinking, 1 to 2 glasses of wine, for instance, a day is fine. If you're drinking, half a bottle of wine a day, then that's a problem. But it's not really a problem so much with the CBD because they tend not to necessarily interact. It's more a problem with the alcohol consumption and the fact that you're going to get drowsy.
Okay, great. I think we can wrap things up now. It's a little past 2 o'clock. Dr. Lim, I want to thank you so much for taking the time out of your busy schedule to deliver such an informative presentation for our PD community. It really was great. And I also want to thank everyone for your great questions. And I'm happy to pass along that information that Dr. Lim was saying. If you send me, was it the referral form?
Yeah, I'll send you a referral form and some information that they can provide, that patients can provide their family doctors. And you can look online as well, both on Perceive MD and Concord Medical Center. We're in the transition phase right now, but I'll send you both information.
Sure, and then I can email it to the registrants today. So thank you so much and have a great afternoon.
My pleasure. Thank you, everyone.
Thanks. Bye-bye.
Bye.